All right. Well, hey, this is the Align Health Insights podcast, episode number 2. This is MCZ Align. This is Mark Chibahusky, founder, with one of my dear friends and professional colleagues, Sarah Butler. So excited to have you on today, Sarah. I've got some great questions prepared for you. And, although we do have a great relationship, I want to learn some more about you. And I'm really grateful to have this opportunity to do that today. So thank you.
Thank you for having me. Very excited to have the conversation with you and look forward to it.
That is awesome. So look, we'll get right into it. I got a lot of questions. If we don't get to them all, who cares? But honestly, one of the things I've been dying to know is like what your earliest memory of wanting to get into the healthcare business was.
Yeah, no. So I actually always thought I wanted to be a lawyer growing up. And so after college, I was working in a law firm. At this point, I'd worked in a really large law firm. I'd worked at 2 different think tanks in DC. I'd worked briefly on the Hill in DC and, was kind of finding my way. And I was at another law firm. It was kind of a mid-sized firm working in litigation. And I was, like a legal assistant, paralegal role. And I was working on lead paint litigation, medical malpractice litigation, and actually some pharmaceutical litigation for Vioxx, if you remember.
Oh, yeah, sure.
Those cases. And in this role, I had to cull through, tons of medical records and help, issue subpoenas for patient medical records. And it really opened my eyes to the inequities in the healthcare system. And, especially in some of the lead paint cases that I worked with, just reading stories about children and what their lives were like and how they had, such issues accessing care, not just for the child, but for the full family. And it really just highlighted for me that public health is such a need. And as I, got deeper and deeper into kind of this process, I just really felt called to be part of the solution for improving healthcare. And so I completely did a pivot, was gearing up to go to law school and then decided that I wanted to do health policy instead. Networked with a bunch of people and everyone was like, well, don't go to law school to do that. And I pivoted and I ended up going to graduate school for health policy. But, it was really an eye-opening experience to kind of have that firsthand experience of looking at the healthcare system from a different perspective than what I had experienced. And I was fortunate enough to always have health insurance and access to care and, was getting exposed to kind of the full spectrum of the experience here in the US.
Yeah, it's interesting. Having worked in healthcare in one way or another over the past 22 years, right? The best examples as to why we're passionate about what we do are real life examples that we can actually touch and you see the results. And you just say, there's got to be something better to actually tangibly help these people who have suffered through, some really unfortunate circumstances due to access or lack of access or what have you. And now, here we are, right? This really complex industry, regulatory capture seems to be the game. We have better science than we've ever had before, right? Better technology than we've ever had before, but the game only seems to be getting harder from a business perspective, right? So, how do you think artificial intelligence will change the healthcare industry? And I think the follow-up question to that, just to get it out of the way, is like, why is trust so important here?
Mm-hmm. Yeah. First, this is like such a huge question. I couldn't possibly answer for all of healthcare.
It's okay.
Yeah, some really, really critical ways that we can see AI, improving healthcare for all of us, that will benefit all of us, things like using AI to match patients to clinical trials and leveraging AI to analyze massive healthcare data sets way faster than humans can, right? And using AI to accelerate drug development by predicting the success of clinical trials. Things like that, I think, are just going to catapult this next, decade plus relative to where we've been before. One of the earliest AI solutions that I worked on was actually with a company out of New York City. I believe they were the first or one of the first AI solutions to get approved for assessing images, for diagnosing breast cancer. And the accuracy rates were way superior to the human eye, and I think things like that are just amazing. And I don't think that it's going to replace clinicians, but I think it's going to really just empower us to do better. But, in the space that I operate in today, which is the pharmacy space,
Yep.
We are very focused on solutions that can create better experiences for patients and pharmacists. And we see AI as a huge enabler of this. Some specific examples that we're focused on is we're using AI to automate the prior authorization process.
Yeah.
We can do this by integrating with our clients' EMR. And if they use Cover My Meds, we can integrate with that too, and can auto-populate and submit the prior authorizations. And why this is such a big deal is, I've heard from pharmacy teams that it takes, and this is at like leading health systems, but I've heard that, for like a health system pharmacy team, on average, it can take about 3 hours per prior authorization.
Wow. Holy cow. That's a lot of human hours, huh?
That's a lot of human hours. And, there's a lot of prior authorizations out there, and this is a highly qualified person. So if we can save them 3 hours on every prior authorization so that they can focus on, helping patients, focus on delivering the care that they, need to be focused on, that's huge.
Yeah.
Some other ways that we're leveraging AI is by doing manual phone calls. And, I also hear from health systems that it takes about 4 to 5 calls to reach a patient, and that's a lot of time, and some calls to be repeated every 30 days to collect patient information on how they're taking their medication. And all of this can be automated using AI in a way that feels like a really high quality interaction for the patient. And on the back end, the information gets reported to the pharmacist in a way that's searchable and clear and saves them so much time.
Yeah.
And another easy example is medication therapy management. Again, typically a manual task for pharmacists. And it involves things like evaluating all of the medications that a patient is taking and making sure that they're managing all of these appropriately, which AI can do like in an instant, right? And it can provide personalized recommendations for patients. And really, it can just accelerate the time that the pharmacist would have taken to do this and enable them to give better care to patients. So I feel like this is just the beginning of how AI can really improve the pharmacy experience for patients and pharmacists.
Yep.
But to your follow-up question, in terms of how trust is important, trust is everything for the patient experience.
Yeah.
And, if we don't have trust, we're not going to have adoption. And clinicians and patients won't use it if they don't trust it. So I think right now is such a critical era with AI, right? Because now we're in that kind of proving that trust phase. And I feel this with my company, right? Like, we've got new novel AI solutions and there's skepticism, rightfully so. And I think as we build up trust, we'll see more and more adoption. And to do that, you've got to have transparency about how the AI is being used and what are the underlying data sources that power it, and how patient data is being treated and protected. That's very, very important.
Yeah, totally. I mean, look, with deep regulatory cuts invariably coming, major stakeholders being focused on the bottom line, solutions like these are certainly going to help with that, right? And then from the perspective of the AI, my understanding is, just listening to like podcasts like All In last week, that the quality engineer is going to be, the most important engineer, which, hasn't been always that way in the past. But at the end of the day, if you have a 97% effective model, that means that 3% of the time you're getting it wrong. And that could have a lot of legal implications, which I think we'll probably see over the next 5 to 10 years. But it's just a necessary component of entering new technology and scaling it in organizations that once have not used it in the past. But yeah, really interesting times. Okay, so here's another big question for you, and answer it however you will. But I just think these questions really just spark generative thought, right? It's like, what has changed, and what do you think needs to change in the healthcare industry? And I think, you can, look at this, from the foundation of where you started, and then you can kind of expand that, and give me the implications for the market that you serve.
Oh, wow. Another big question. When I first started working in healthcare, a ton has changed since then, and I've seen amazing therapeutic advances. Like I got to work on drugs like the immunotherapy products for oncology, which have been game changers. And now we've got GLP-1s, all these therapies. But, from the lens of where I sit, we're really at an interesting point in healthcare where consumer expectations have shifted dramatically. And, patients now expect healthcare to be as seamless as online gaming or ride sharing, right?
Yeah.
We are forcing the entire industry to rethink how care is delivered and accessed and paid for. And, in some ways, this has been a very quick shift. In other ways, this has been a slower shift. I think healthcare has been kind of slow to catch up to this consumerization.
Hmm.
Digitization has accelerated.
Yeah.
It's absolutely everywhere, from like wearables, to EHR to claims, but raw data isn't itself valuable. It's what you do
Hmm.
with it. And that's where I think AI is starting to play a really transformational role. And in pharmacy in particular, that's undergone, a bit of a revolution. It's no longer just about dispensing products at the pharmacy,
Yeah.
right? Like that was kind of my experience with pharmacy until very recently. Now it's kind of like a clinical front line. Pharmacists are managing chronic conditions, they're delivering vaccines, they're supporting adherence in a way that directly impacts outcomes. And now we're starting to see more of that demand for pharmacy meets, the digital experience. And digital pharmacy platforms, I think are going to redefine the way that patients get their medications and how they experience pharmacy, faster, cheaper, and with more support. And, imagine an AI system that instantly handles prior authorizations, that checks a patient's benefits or insurance, that initiates a patient communication to let them know the status of their prescription, that flags high-risk patients for the pharmacy. That's not theoretical. It's where we're heading very, very quickly. But without AI and trust in AI and transparency, and oversight, to your point, like that's a non-starter, especially in healthcare where people really need to believe in the tech that's working for them, and, believe that using tech for some of these action items is the right decision. So I work with a lot of health systems right now, as I've mentioned, and nearly all
Yeah.
of them are AI committee. That's something new. I don't think we could say that 3 years
Yeah.
ago even.
No.
Yeah, and in terms of kind of my outlook on the market, in the market that I serve, I'll continue to focus on pharmacy here, but pharmacy is no longer just about dispensing at the pharmacy counter, as I mentioned. It's become like a new front door
Yeah.
for care, and pharmacists are trusted and accessible. And I've seen stats that patients are actually more loyal to their pharmacy than they are to their physician. Like a
Interesting.
patient might see like 8 different providers throughout the course of a couple of years, but they'll keep going to the same pharmacy.
Yeah.
So figuring out how we fully leverage that, that for the patient's care journey is really important. And health
Yeah.
systems in particular are getting super serious about technology partners that can prove outcomes for the pharmacy
Yeah.
experience. And whether that's faster access and better adherence, all the fluff is gone. It's all about outcomes because, everybody has limited budgets in healthcare. But I
Yeah.
think it's really an optimistic time. The market is really receptive to AI and digital solutions for pharmacy that can improve the patient experience. And I think we're going to see some real winners emerge in the next couple of years. Those who can prove value across access, affordability, and outcomes. So I think it's an exciting time. And,
Yeah.
if we want a healthcare system that's proactive and equitable and sustainable, we have to stop asking the patients to do the
Yeah.
heavy lifting, frankly. And I think this is where our technology can carry a lot of that burden,
Yeah.
and let the clinicians and the pharmacists, really focus on delivering
Yeah.
patient care and,
Yeah.
enable that through better tech.
You said a lot there. Well said. One of the things that's just sticking with me is like, okay, so you always had like the two key relationships with a patient were always the physician and the pharmacist. But now, whatever data you're seeing on the ground, which I think is a really interesting insight, is that pharmacist relationship is almost becoming the more trusted relationship, right? Look, you look at the high patient volume, right? You look at all of the consolidation in healthcare. I mean, just firsthand, I was at Einstein, which became, independent practice, became Einstein, became Jefferson. And I had like 5 different doctors in a period of 18 months, right? So it's just interesting. I mean, then, the technology becomes the solution, but it's a byproduct of all of these things that we're seeing, these general trends. Very interesting. Yeah. All right. So look, from my perspective, like having an opinion, being a talent person, right? I think distribution of your technology in a very entrenched market becomes a very large, durable competitive advantage in the age of AI, right? Where there's 151 automation use cases across the industry. So I think getting the best talent, in my opinion, is one of the biggest durable competitive advantages, especially when it comes to commercial teams. What are you looking for in candidates to join your company? And what is the single most important characteristic you're looking for when you hire someone onto your team, Sarah?
Oh yeah, great question. We're a seed stage startup, so at this
Yeah.
point, I am looking for experience that can translate into impact immediately. I
Oh,
need
yeah.
that combined with drive. Like we need people
Yeah.
that are hungry, and leadership hires, like at the leadership level, it's so important for our leaders to have a shared vision for our company. And
Yes.
in health, I've actually worked with our CEO before. I worked with him previously at TruePill, same with our
Mhm.
COO. And I've learned from other professional experiences that I've had, how it is really, 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 really important to respect the vision and leadership style of the CEO. And I have so much respect for Omar and what he's capable of building and his vision. And I think, as we build out our leadership team, we need people that also really, truly believe in the vision and are committed to it, and are committed to the kind of proactive, positive, let's improve the healthcare system vision that we and have this ability to kind of execute quickly and effectively, and are willing to learn and evolve on the go, because we're moving
Mhm.
at a really quick pace. And so
Yeah.
basically, we don't have time to handhold, right now. And
Yeah.
so people that are willing to step into a fast-paced environment, that have great skills that can be leveraged, that are curious, and that acknowledge we're going to make mistakes. Like we're
Yeah.
innovating, and
Yeah.
that's not something that everybody's comfortable with. Being
No.
kind of thrown into a new environment, maybe not with all the same resources you had before, and so that kind of resilience is a really important skill that I look
Yeah.
for.
I wonder, the next question would be like, what's the trouble you have finding the right talent? But I think it's almost like the inverse of a lot of like those really foundational characteristics that you're putting down. But a lot of it is so intangible, right? You have to really look at the person. They've got to have the track record, and then it's like all these other qualities, right? So, when you're assessing these candidates, I mean, what trouble do you have finding the right talent? Is it hard? Is it hard to get the right person, that right fit for you?
It's always hard. And um, it's one of those things where when you really need someone, I
Yeah.
have to remind myself, like, take the extra time in the hiring process because it's so important. And I've learned that lesson the hard way. I'm sure we all
Yeah.
have learned that lesson the hard way. And right now there's a lot of healthcare expertise on the market.
Yeah.
There's a lot, unfortunately, or fortunately. I think for us, a big challenge we're having is on on the engineering side, like finding
Mm.
individuals who can really live up to the demand, and understand that this is a startup, and if we have significant opportunities that come up for us as a business, we prioritize those. We can't tell you what you're going to be working on for the next 6 months or even 6 weeks necessarily. It's kind of like week by week, what is top priority, and we need individuals who are flexible and can go with the flow and keep up that pace. But for me, that's kind of like a really tangible, specific example. But for me, with hiring, at this point in my career, I love to work with people that I've worked with before.
Yes.
I love to do that, and because it's a known entity, and nobody's perfect. Everyone has their strengths and areas for growth. But if you know what you're working with, it's kind of more efficient, for lack of a better term, for getting them fully functional on the team, and you can really match that to your needs. But if I'm not able to, work with someone that's kind of a known person to me, it's just hard to assess for all of those things because, some people are amazing at interviewing, and until you really get them,
Yeah.
in the role, it can be hard to assess. And I know you know this better than I do, but yeah, it's hard. It's always hard to find the right talent, and something that, we're thinking about all the time, even proactively as we go into this next year, which is going to be a big growth year for us.
Yeah.
Want to be really deliberate in our hiring.
Well, I mean, look, I thank you for that answer. And it just brings up two things, and I can't believe I'm doing this, but shamelessly, I have to tell you, we're building several engineering teams right now, my team and I, and got some interesting takes there for you. So we should talk about that
Yeah,
sometime.
love
But
to.
message to candidates, right? And tantamount to what Sarah's saying, really what it comes down to is it comes down to developing good foundational relationships with everyone that you meet. In the ecosystem that may be of value to your career in the future, right? Because these foundations get developed over a period of time. Like Sarah, you and I have been talking now for a number of years, right? And it's that consistency, and it's getting to know the person's
Yeah.
style. The ability to deliver these short streams of value to these people over time, so that when it comes time to transact or it comes time to more officially work with one another, that table's already been set. I think it's a good piece of advice to share with our audience.
Yeah, you do such a great job of that, which is why I
Uh,
always love connecting people to you because you're a great relationship builder.
I really, that means a lot coming from you. Thank you very much. Now, look, we're going to have one more question and then we're going to go into like some just rapid fire fun questions that honestly, I want to know these things because some of these things are important to me. And, so look, really quickly, do you use outside search partners for talent? Is it important? I mean, can you just do this stuff on your own? What is your guys' take on that at Foundation?
Yeah, I mean, right now we're using them for like specific roles. And in my experience, if you're, going outside of your own personal network, as I was mentioning, like having a search partner that you trust, that understands your company, your
Yeah.
expectations and needs for the role, it can be a massive time savings, and not just on the recruiting side, but on the onboarding side. It's all about
Yeah.
hiring the right person, and so we're very supportive of doing that. And as we grow in the next year, I think we'll need more support. Hint, hint, Mark. But like
Awesome.
as we go more, I think we'll need that because frankly, like we don't have unlimited bandwidth, and
Yeah.
we're a growing company, and so to the extent that we can outsource that service, that's really high value for us.
Awesome. Awesome. Well, look, I love music, right? So I don't know if anyone knows this, but I produce my own dance music, and I've DJ'd for like 15 years. So I love music, right? And I think it just, it's one of those things that shortens the distance to emotion. And that's one of the things I love. People can listen to a song and it brings you back, right? You can remember where you were when you first heard it. What's your favorite song, and where did you first hear it?
Yeah. Okay. Well, first, I think the next podcast should focus on highlighting some of your work. That would be fun. Um,
The jingle for the podcast, I'm going to make it. The next podcast will be my own homegrown jingle. So
that's awesome. I would love to hear more about this. But let's see. My favorite song, and where I first heard it is easy. Beast of Burden, Rolling
oh yeah,
Stones.
love
First
one,
time
love
I
that.
heard it was in my dad's car. But the
Aw,
first time that it like moved my soul, I was at a bar in Lawrence, Kansas called The Wheel. Uh,
okay.
I don't think I was of age to be at that bar, but I was there dancing with some of my best friends in the world
Aw,
and just like having one of those moments where I just had this awareness, like this is one of the best times of my life.
that's
And
so good.
every time I hear that song, it just takes me back to that moment, and I just love it. I find it very soothing.
I love the Rolling Stones. That's a really beautiful answer. Thank you. So, okay, like it could be the first productive thing. It could be like the most important. I don't know how you're going to answer, but what's the first thing you do in the morning? Maybe you break it up into a productive and a non-productive. Whatever. I want to know.
I mean, I consider this both non-productive and productive, but very necessary. The first thing I do is make myself like a fabulous cup of coffee.
Yes.
Espresso maker. I make an Americano with my special beans and all of that. So like that's a must do for me in the morning.
I love coffee. I'm with you. It's like one of the third. I think I drink a glass of water beforehand. I do, but I love that coffee. That is my time. It's the best thing. So, all right. So, here's another one that's just, answer this however you want. I've had people do multiple people. I've had people do one person. I've had people just esoterically answer this. But if I had to ask you who you most admired in healthcare, like what leader,
Mm.
you know, would you be able to answer that question?
Oh, I don't know if I could give one
That's fine.
name. And like, when there's a great leader, there's always great people supporting them. But I guess I'll take the esoteric path, but I'm gonna say the founders and the innovators. I have like a newfound respect. This is my first time being at a seed stage startup, and um, I tend to be a little bit more of a risk averse person. And I just really admire the people that really are willing to risk everything at times, to bring something innovative to the market because they have such a vision. And yeah, I don't think I can single out one person, but yeah, those that are brave enough, driven enough to start something new in healthcare, that are committed to their vision. I just think that's going to help keep propelling us forward. And if that were to stop, it would be a very different existence in the U.S. healthcare system. On the research side, on the technology side, it's just so important to continue to innovate.
Let's hear it for the founders. I agree. It's a good one. All right. So my favorite season's coming, which is summer, because I love the warmth. Not a fan of the winter, even though I live in the Northeast. What is your favorite season
Oh,
and
this
why?
one's easy. I'm a summer person as well.
Yes.
I live in Seattle and our summers are hard to beat. We've had a pretty beautiful spring here, but typically our summers are, beautiful, sunny, about 75 degrees, crystal clear days. It's like truly magical. So I've
Wow, that
always
sounds
loved summer,
beautiful.
but now I appreciate them even more living in the Pacific Northwest.
Yeah, well, and you are a tennis player, so I bet it's easier to get out and play tennis when it's warmer, yeah?
Oh yeah, absolutely. I've been
So
playing a lot lately.
awesome. All right. So, what is your most prized possession if you have one and why?
Oh yeah. I'm not really a things person. Like I don't
Yeah.
really get attached to objects. Um, but for me, like my photos and like that hold my memories are definitely my most prized possession. Like I'd say like if my house was burning down, like I just need my like phone and some of my old photos. I've scanned them all. I'm crazy about backing up my photos on multiple platforms. I think I back up my like iPhone photos on 3 different platforms. I've scanned all my like, paper copy photos. And to me, they're just like so cherished. I would be so sad if I lost all my photos.
Yeah.
So
Funny, Katie and I just got a scrapbook, right? So I think there's something about having the actual physical photos that's also pretty cool,
yeah,
to be honest.
yeah,
All right. Well, look, um, this has been my second podcast, right? You are the second guest. Thank you so much. Really, again, so grateful that you took time out of your busy schedule to meet with us today. And we'll probably do something again. I don't know, but
yeah.
this has been a great start.
I look forward to it, and I love that you're creating this platform. You're innovating, love it, and I'm really supportive. So thank you so much for the opportunity to chat with you this morning.
You're welcome. It's that confluence of market expertise, but just who are these people? Because I mean, healthcare, let's just face it, it's deeply personal, Sarah.
Yeah.
Yeah. So thank you all. This has been Mark Chubusky with Align Health Insights, episode 2 with Sarah Butler. Tune in for more next month. This has been Mark Chubusky with MCZ Align. Thank you very much.
Thanks,
All right.
Mark.
Thank you.